Hello, everyone. My name is Tiara Brooks, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Health, Schools, and Public Housing, Uniting for Young People's Success. All right, and we have a few housekeeping reminders. All attendees are in listen-only mode. However, we would like to hear your questions. But first, to all of our attendees, if you can please enter your name into the chat box if you have others joining you today. For example, Tammy Jones +3. Also, if you have any questions during the webinar, please enter your questions into the question box. And at the end of the webinar, we do have evaluation poll questions that we would like to hear from you. So please answer the evaluation poll questions at the end of this webinar. The School-Based Health Alliance is the national voice for school-based healthcare. We support school-based health centers through technical assistance and training. We advocate for SBHCs on the federal, state, and local levels. We demonstrate the value of SBHCs with common standards, measures, data, and research. All right, we do have our objectives for today. So during today's presentation, participants will discuss the needs of children and adolescents with public housing and successful health center strategies for creating partnerships between housing and education sectors. I would now like to introduce to you our presenters for today.
Hello, my name is Selena Moore. I'm Program Manager here at School-Based Health Alliance. I've been with the organization for 3 years now and overseeing one of our grants with the Bureau for Primary Health Care focused on children and adolescents and helping health centers to increase their access to care, improve on social determinants of health, as well as increase the work they do with young people in terms of youth development. And so looking forward to speaking with you all more today about one of our resources that informed this webinar.
Unmute. Hi, everyone. My name is Emily Grace Kane. I'm with the National Nurse-Led Care Consortium, which holds a national cooperative agreement from HRSA. I'm a program manager here, so I oversee all of our HRSA activities in providing training and technical assistance to health centers, particularly around providing access and equitable care for residents of public housing.
Hello, everyone. My name is Maria Sanchez, and I work for San Isidro Health. We are a community clinic, and I manage a clinic program which San Isidro Health Center creates relationship with public housing sites. And I'm interested in knowing your answers to my poll questions. I'm interested in knowing about a little bit more about the group, and hopefully our presentation will help answer questions or make your program better. Thank you.
Thank you very much. We will now continue with our presentation.
So more about the focus for this webinar. It was inspired by our health centers and schools uniting for young people's success partnership that also inspired the title for this webinar. And it grew out of a need that we found along with fellow NCA partners, particularly the National Association for Community Health Centers, on assisting safety net providers like yourself in wanting to connect and partner more with schools, but not necessarily ready or wanting to initiate that through a full-fledged school-based health center program. And so we did a lot of work surveying. Some of you might have been a part of that group that we surveyed of health center programs across the country to understand more about what work you are currently doing in schools that is a non-SBHC program. And the results of that led to this resource. We have videos on the website that let you know from the education and the health side how a partnership like this is possible. case studies from health center programs across the country, as well as strategies related to policy, activities, and education that you can implement or start as your strategy for connecting with your local schools. And a little bit more about what we learned when doing the research for this resource and speaking with health centers across the country was just how many there were out there that were partnering with primary or secondary schools in their community. We surveyed 128 health center programs encompassing hundreds of health center sites, and 47% of them were currently had a formal relationship with a school providing services or education, and outlined here are some of those different opportunities that they have engaged in with schools in order from least to most prevalent. From this information, we had further conversations to find out the specifics of the services provided and the populations that were served, which in collaboration with National Nurse-Led Care Consortium led to a focus on public housing. And with the information that we found comparing UDS 2016 to our National School-Based Healthcare Census for the 16-17 school year, 61% of health center programs comprising 360 health center sites currently have public housing funding. And this includes health centers that are non-SBHC as well as those who don't currently have a school partnership. We also then found that for school-based health center sites, 44 health center programs comprising 144 SBHC sites and 780 health center sites in total have public housing funding. So whether your health center operates SBHCs, has a school-based partnership, or do not have a school relationship and want to initiate one, just from this information alone and the conversations that we continue to have with health centers like yourselves show that utilizing public housing dollars is one opportunity to connect to your younger patients and coordinate service delivery between home and school. To share more now about the specifics of public housing health centers is Emily from NNCC.
Thanks, Lena, and thanks again to all of you for joining us for today's presentation. As Lena said, my name is Emily Kane, and I'm a program manager here at NNCC. So National Nurse-Led Care Consortium is a member organization that supports nurse-led care across the country. Our mission is to advance nurse-led healthcare through policy, consultations, and programs to reduce health disparities and meet people's primary care and wellness needs. We're supported in part by the Health Resources and Services Administration of the U.S. Department of Health and Human Services through a National Training and Technical Assistance Cooperative Agreement. So before we take a deeper dive into counting public housing and more about the public housing program, let's take a look back at the origins of the health center program and later discuss the special subset of health centers that receive funding to support residents of public housing. So in 1965, the Office of Economic Opportunity funded the first community health center program, which was Columbia Point Health Center. It served the low-income community living in the Columbia Point Public Housing Projects in Dorchester, Massachusetts. And then in 1975, Congress permanently authorized neighborhood health center programs as community and migrant health centers, and later added primary health care programs for residents of public housing and the homeless to the portfolio of programs. Finally, in 1996, the Health Centers Consolidation Act combined these authorities under Section 330 of the Public Health Service Act, PHSA, to create the Consolidated Health Center programs in what is now known as Community, Migrant, Public Housing, and Homeless Health Centers. So while some health centers receive specific funding to serve residents of public housing, all health centers, regardless of funding, must report on Table 4, line 26, total patients served at a health center located in or immediately accessible to public housing. So what exactly is the criteria for counting public housing residents on the UDS? In a nutshell, HRSA uses a location-based count to determine the number of public housing residents served at health centers. This means that instead of counting individual patients who reside in public housing, health centers must determine whether their location is accessible to public housing. And so the definition of accessibility is up to the health center. For example, if your location is easily accessed via public transportation or is in the same zip code as a public housing building, then you can consider all your health center or your health center in that site specifically to be accessible to public housing. And so if you do determine that your health center is accessible, you count all the patients at that site on line 26 of Table 4. So it's important to be able to determine your health center's proximity, to public housing, and there are a few strategies to make that easier. You can partner with NCA organizations like us here at NNCC to get a better sense of the public housing landscape in your state, and you can discuss findings with your staff and your PCA to determine what criteria make sense for your health center. You can also use a variety of great mapping tools such as UDS Mapper. And so what we're going to talk about a little more today on today's webinar is partnering with community stakeholders. So by partnering with community stakeholders, you can really get to know and assess your health center's proximity to public housing. So Maria from San Ysidro will discuss some of her health center's partnership strategies, but we've also listed a few for you here. First, take inventory of which organizations in the community serve residents of public housing and take steps to engage in dialogue with those organizations. Second, identify common interests. A good example of a common interest for housing authorities and health centers is HUD's rule that all federally funded housing sites must be smoke-free by July of 2018. Health centers can share the smoking cessation services that they have in place to help patients and brainstorm ways in which housing authorities can promote those services. Finally, set up channels of communication that will remain open even if there is turnover at your health center or the housing authority. This could be as simple as creating a memorandum of understanding between your agencies or writing each other into your strategic plan to maintain continuity. So again, please feel free to reach out to me with any questions about the PHPC, Public Housing Primary Care Program. I'm happy to assist you in identifying community partners, mapping public housing in your area, and discussing new service area opportunities. And I'd like now to turn the presentation over to Maria Sanchez of San Ysidro, who's going to share a little bit more about her partnership with public housing at her health center.
Great, thank you, Emily. I'm now trying to set up my slideshow. Okay. So elaborating a little bit more about what our collaboration with San Ysidro Health with public housing is. I'm going to talk first about something a little bit about our mission. It's to improve the health and well-being of the communities we serve with access to all, and our vision is to be recognized in the community as a patient-centered, high-functioning, and high-valued-based health center organization.
Hey, Maria, I'm so sorry to interrupt. Can you, have you shared your screen?
Oh. Maybe not.
Maybe not. It's okay. There we go. Great. Thank you.
Okay?
Yeah, thanks. Yes,
okay,
we can.
I'm sorry about that.
No problem.
Thank you, Emily. So I was talking about our mission, and so we were founded at 1969, and if you can see in the slide, there's a picture of a casita. That's actually the original casita that started our organization. It started of an idea of 6 women that were concerned about having accessible care for their children and having no close hospital or clinic. They were determined to make an impact in their community, and then 49 years later, we were this state-of-the-art organization. I'm having issues with my arrows. Emily, can you give me a hand here? I cannot.
Sure.
I cannot go down I cannot change the slide.
Let's go ahead and I'll change the slides for you, Maria, and you can just say next slide. How about that?
We'll do that. Thank you. Okay, can we go to the next slide? Are you able to change them now?
Yes, just do that in a second. And here we go.
So next slide, if you can. Oh, it seems I have my control back. Now I can change the slide. I don't know if you're able to see them.
No, I took control back, Maria. That's okay. You can just say next slide.
Oh, okay. So I think I'm having issues with now seeing yours. Okay, are we on slide number 3, services and locations? I don't know, for some reason, I don't know what I did.
Yes,
But
that's where we are.
I'm here. Okay, so from that little casita, we became this state-of-the-art health center, now consisting of 15 clinics. We have 5 mobile units and countless programs throughout San Diego County. Some of our most popular programs are the Teen Clinic and our Casa, Our Place. Our target population there is our HIV population. Not to mention our transportation services, providing curb-to-curb service to all of our registered patients to and from their clinic appointments. Other important services that we provide is insurance enrollment. We have CES at all clinic locations, that's Certified Eligibility Specialist, that in our clinics, they're ready to assist our uninsured patients and help them get coverage. In this slide, it's actually, you're seeing a map of our clinic locations, as well as our programs. So our organization has created a great reputation in the community. That is the reason that other community health centers have reached out to us when going through difficult times. That is the main reason that San Isidro Health Center has grown so much in the last 10 years. As you can see, we have an extensive service area covering around 20 miles, all the way from the border with Mexico. You can see where it says San Isidro, that's our closest location. We're actually, our first clinic, it's actually located in the first trolley station when crossing the border from Mexico to San Diego. That also is a part, no, you can go to the poll questions, but I just wanted to mention that that's also a challenge for us, having population that is crossing the border constantly. So our first poll question is, how does your health center partner with public housing? Is it on-site services via public housing center, providing services via mobile clinics such as we do, referral linking services to school-based health centers or federally qualified health centers, or no current ownership? This will give me a better idea of how all of you are providing services to public housing sites, if any, currently.
Great, and we'll take a couple more seconds to give everyone a chance. Okay, great, thank you. So we have 57% that's referrals linking residents to HVAC or SQHC, and 43% no current partnership.
Wow. Wow. I thought it would be at least a little bit of on-site services. So hopefully for those of you who don't have a current partnership, maybe you can take the next step and think about a way of providing services at public housing sites or connecting a little bit further. So now we'll present an overview of our services. As you can see in the picture, that's one of our state-of-the-art mobile units. We have a total of 3. We have one that's a school-based mobile unit serving 2 high schools currently in a weekly basis. And we have also another one, 2 mobile units that do provide services throughout the community. Our program started as a First 5 grant back in 2001 with 2 medical mobile units. And in 2012, we received a school-based mobile unit as a result of a successful HRSA grant. Our school-based mobile unit currently attends 2 high schools on a weekly basis, and we have strong partnerships as well with 2 elementary school districts, which is San Isidro School District and South Bay Union School District, and we attend their high schools, their elementary schools at least once a month, as well as serving other community partners. Next slide, please. So our mobile health services, we mainly provide well child exams, school entry, sports physicals, camp physicals, foster placements physicals, immunizations. We provide health education, vision and hearing testing, blood and hemoglobin test, pregnancy, TB test, and minor sick visits. Our most popular service is the school entry and sports physical exam, and that's mostly what we do when we provide services in the high schools or elementary school. So we offer medical services at a location convenient to our patients, and I think this is crucial in regards to the success of providing services to residents of public housing, that we connect, we come to them. So we help guide them to a fixed site medical home for ongoing and affordable quality primary care, medical, dental, behavioral services. So the medical mobile unit's main purpose is to eventually connect our patients with a fixed site clinic, as well as make our service as convenient as possible by coming to where a patient lives or shops or learns, such as schools. So being a mobile clinic program for the organization connecting with the community is one of our main focus. Next slide, yeah. So community partners, as you can see, we have a whole variety of them, from school districts, Head Start, apartment complexes, affordable housing, low income. We have grocery stores, strip malls, resource centers, faith-based organizations, partner with a food bank. And as I mentioned before, being accessible for our patients is very important for us. That is the reason that in our case, partnerships are essential to the success of our service delivery. For example, it's very efficient for a mother to bring their child to school and be able to come into our mobile unit and complete their physical as well as vaccines in the same visit. So she doesn't have to make an extra trip. If the barrier is transportation, well, that's overcome by us being in the schools. We also, you will see in future slides, that we provide clinical breast exams when we go to some of our grocery stores. We have a partnership and an event. So if a woman goes to purchase her groceries for the day, she can go into our mobile unit and actually get her mammogram. So patients are going to a place that they feel comfortable with. So that has proven for us to be really successful in presenting our services. If I may talk a little bit about going back to community partners, about our target population, talking about Latino population, we are really not very proactive in our health. So we only go to the doctor when we're sick. So if you're going to your grocery store and you're constantly being bombarded by a mobile clinic that's offering health services for your child, eventually they'll come and it's going to be convenient for them and they're going to have the services there for the children. So again, having community partners is the key to success. Next slide. So talking about our public housing numbers, these are based on our UDS numbers for our organization. So we have 6,471 unduplicated public housing residents that receive care. And during 2017, we generated a total of 36,841 patient visits. And we have relationships with 17 public housing sites mainly through our mobile unit services. And the mobile unit visits 9 of these sites. And our partnerships range from 2 to more than 13 years old relationships. I'll tell you a little bit more about them in future slides. So through our organization and based on UDS numbers, we have a very proactive collaboration with 9 public housing sites, mainly provided by our mobile unit and our health education department and our eligibility department. And I know that numbers must be higher than what is recorded because sometimes people do not identify themselves as living in public housing. Next slide, please. Wonderful, another poll question. So who is your main point of contact in the public housing site? Is it the resident services coordinator, housing and development corporation manager, community liaison, or resident volunteer? So you have a few seconds to answer. I know that for my program, a key person to have as a main point of contact is the resident services coordinator.
Okay. Yes, and we show that the results are 50% resident service coordinator and 50% housing development corporation manager.
Okay, nice to know. So I think we are on point. So based on your answers, I'm going to say that I totally agree with you. In my experience, we start off the relationship with the public housing site through the housing manager. As Emily mentioned in her presentation, we usually start a relationship and develop an MOU and provide liability insurance. So once that is in place, then we move to our relationship with the resident services coordinator. So we start off with the housing manager, and then we go to the resident services coordinator because that's the more hands-on person we have there. And so it's really important, and I'm going to talk a little bit more about it in future slides. But the way we partner with the public housing is, as I mentioned before, we visit the public housing site through our mobile clinic. Sorry about that. And providing medical mobile unit services as the ones I mentioned before. And we also provide health education classes. And we also partner providing special events or health fairs. We usually do that in collaboration with other community services. So I know that for the housing manager, I just want to highlight that. I'm going back to who's your main point of contact. There will be an instance where they don't have a lot of time to invest in your collaboration because they have other duties, and so you want to be putting more effort on your part to overcome the imbalance or find out if there's another person, such a resident volunteer, community liaison, or some person that's really active in your public housing site as well. Next slide. So I wanted to share with all of you our monthly medical mobile unit calendar. As you can see, I highlighted our public housing sites in yellow. That's so you have a better idea of what we do. There's 2 teams that go out each day for to the community, and there are sites that we attend on a monthly basis, always in the same day, and always the same day of the month, so residents get used to our days. As an example, you can see on March 10th, that's a Friday, there's Oxford Terrace Apartment, and we attend that site always on the 2nd Friday of each month. And that's the day that they also have their food drive. So the food bank is there, and they're providing the food to the residents. So we're sure that we're going to have a good outcome in regards to attendance. And we also have another site on Monday, March 6th, Vista Terrace. That's always on the first Monday of the month. We have many patients that call us to schedule an appointment at their site because they know that we will be there. So they just ask for the day when the mobile unit is attending their site to be scheduled on that day because they lack transportation or just because it's convenient. Next slide. So our other popular collaboration with public housing sites is our health education portion of our program. We provide classes and workshops in different topics, such as parenting, anger management, self-esteem, co-parenting, and we connect patients with mobile clinic and other community resources. We have found that this is a great way to start relationships with public housing sites. In my specific example, we have three components for our program, which is the mobile clinic, the health education, and the transportation. So when we offer the health education, it's easy to start, it's easy to set up. We just need a room. And then from when we establish a relationship through our health education classes, then they're more likely to consider us having our mobile clinic at their site because we already have an existing relationship with them. So I know that public housing sites are always looking for resources that might benefit their residents, or having some type of health education is a really simple way to start a relationship, a great relationship with. And we have been really successful in regards to starting a relationship through our health education classes. Thank you. Collaboration for events, that's another key component of our partnership. And I think this is a really great way of connecting with public housing residents. So when we collaborate for events, we obtain usually it works this way. We obtain approval from property management. We secure appropriate space inside the property. We coordinate logistics for booth setup. Look for additional community resources. We always, as I mentioned, with other community partners, is always key to partner with additional resources. In our organization, we're fortunate to have our certified eligibility specialists. They usually go with us to the health fairs. So we would bring our CESs. We would also invite our dental department. They sometimes come out, they bring a dentist on site, and they do dental screening for the patients, for the children. And we also promote events among residents through flyers or through their newsletter. And we usually arrange activities for children and blood pressure screening for adults, other insurance enrollment, and we also offer free HIV testing on site. So our program coordinator is the one who oversees the event in collaboration with the resident services coordinator. When I was talking a little bit earlier about how we transition sometimes over from a partnership that started with our health education department, it's because there's a lot of challenges when we want to partner with our mobile unit due to parking requirements. As you can see in the second bullet for this slide, secure appropriate space inside the property. That's usually a huge challenge for us. That's why sometimes we're not able to attend all the public housing sites that we partner with due to the challenge of parking the mobile unit. So when we are collaborating for events, I found that our relationships grow mainly due to the amount of planning and communication and just sharing the same goal to assist and bring services to the residents. So I think having that is key as well. I just wanted to highlight our adolescent-friendly programs. We have a teen clinic that's free and confidential, and we have several services there for them, and such as STD testing and treatment, pregnancy testing, counseling and referrals, counseling for healthy relationships, sexuality, etc. We also have a youth enhancement services program, and that's behavioral health for aimed at youth. We have individual and family group therapy, substance abuse counseling, and psychiatric services as well. We mostly refer the patients that we see in the high schools that I mentioned earlier. We have a lot of referrals from us and from the nurse to our teen clinic, which is close by Chula Vista High School, one of the high schools that we closely collaborate with. So our next poll question: do you find your relationship with the public housing to be very successful, fair, poor, or we don't have a relationship with public housing sites?
Thank you, and we'll take a few seconds to answer the question. Thank you, everyone. Okay, we have 33% successful and 67% fair.
Thank you, Selena. I'm seeing that from fair we can improve a lot. Hopefully, some of the ideas I provided will help you. And if you need additional information, I'm available by email. I'll have my contact information at the end, and I'm sure it's going to be available for you as well. Can you go to the next slide? So some of the accomplishments for my program specifically is that we have been able to maintain relationship with some of our public housing sites for over 13 years. And through our medical mobile unit program, we started the successful school-based health center that we have in Lincoln High School. And so we transitioned. That's also the benefit of having the mobile unit. We often transition either the patient from receiving care in our mobile unit, transition them to a fixed site medical home, or having them being cared for in our mobile unit inside their high school and transition them into a school-based health center. We also have a great relationship with Chula Vista High School since 2014. That's one of our most populated high schools. They have over 2,400 students with just one nurse, so we help a lot there. And there's a lot of need for services. Hopefully we will have a school-based health center there someday. We also have been able to put together a breast cancer awareness event in collaboration with Susan G. Coleman and one of our partners, Northgate Markets. So I mentioned earlier that through the events, we've captured a lot of women that if it wasn't for the event, they wouldn't be going to a doctor to get their mammogram. We often have women that are getting their mammogram for the first time. So it's really special for us having created that format of providing services and preventive services such as clinical breast exams to women, to uninsured women. We also started a collaboration with Northgate specifically uh, for Day of the Child. That's done usually in the last Friday of April. We have that coming on April 27th. So what we do there is we provide preventive medical services. We have a dentist on site. We're going to have a dentist on site from 1 to 4 p.m. providing dental screenings, and he will be completing as well their oral health exam form for school. We partner as well with our ECS Head Start. They come and they do activities for children, so it's a really fun event, and we're able to get a lot of children that are not up to date with their immunizations, or they need a health assessment or dental assessment. So we find that format to work wonderfully. The Northgate Market that we partner with is located within 2 miles of our clinic location and is surrounded by public housing sites. We make sure we always promote our event with the school district as well as the public housing sites. So they'll be aware and they'll bring their children. Next slide, please. So some of our best practices and tips in connecting with your public housing sites, especially for those of you who don't have a relationship. So usually we reach out to the resident services coordinator. Something that I found very helpful is to not overdo the communication. Sometimes we're so eager to provide services and we are investing so much time in it that we constantly communicate with them, with the resident services coordinator, and they have limited time on their hands to for relationships or collaborations. So don't overdo it. Just be mindful of everybody's time and be a low maintenance program. That's how I call it myself. I'm very low maintenance in regards to communication and contact. We usually dedicate a day out of each month to visit the sites. Usually take some flyers for when the mobile unit will be attending that specific site, as well as collaborating with their newsletters. So hopefully an article that's related to health will come out and we'll somehow link that article to our mobile unit services on site. Invite and coordinate your visit with other programs that may interest the residents, such as food banks or other community resources. As I mentioned before, we often partner with many community resources. I think the most successful one is the food bank. So usually when they're giving out the food, there's a lot of residents that come out and plan their visit to the mobile clinic as well. So having 2 or more services at the same time, it's definitely a win-win for everybody, and it attracts more community and public housing residents. We also attract residents by providing free screenings, as I mentioned, and we are going to provide the dental screenings for the children in our Day of the Child Health Fair, and I know that's huge because parents often need that form filled out to get into either preschool or school, so that they'll definitely come out for that. And also the blood pressure screening for adults is really popular. Schedule residents for additional services on site, such as dental appointments, as well as transportation services. Our residents are there already, and if we talk to them, if we engage them, and we find out that they need additional services, we often try to make the appointment then and there. So they will leave actually with a little appointment card that states that they have a dental appointment for this or that date. We found that that is huge, like getting them to get the appointment right then and there. That's key for them to attend. Transportation services as well, if we identify that that is a huge barrier in attending one of the clinics for additional services, we usually call our program and set up the transportation appointment pickup, and so they can go to their appointment as well. And I think that is that was the final slide for me. Again, thank you so much for hearing me out and learning a little bit about what we do, what our program does, and hopefully something will help you improve your relationship or start one. If you need to contact me, that's all my information is there, and I'm sure it's going to be available later as well. I'm open to a call or email if you want me to talk to you a little bit about something specific that you may need help with. Thank you so much.
Great. Thank you so much, Maria, Selena, and Emily, for your presentation. We do see a couple of questions that are coming in, but before we get started, we do have a few announcements. We'd like to discuss our membership. So if you'd like to become a member at School-Based Health Alliance, we ask that you please visit our website. Our membership includes program tools, timely publications, and networking opportunities that we have at School-Based Health Alliance. And also with this, we do have our 2018 convention that has come up in Indiana this year. As the premier national gathering for our field, the convention is a fantastic opportunity to connect with hundreds of fellow school-based healthcare professionals and advocates from across the nation. And also, we have What Makes a Student a Leader? Be the Change. It's a great opportunity for young people at our Be the Change youth training program. Each year, students from across the country come to network with each other and school-based healthcare advocates and participate in various workshops pertaining to health, education, policy, and leadership. More information is available on our website, and scholarships are also available. So please visit our website for more information about our membership, our convention, and Be the Change Youth Training Program. Now we would like to just answer a few of your questions. You hear from us, and now we would like to hear from you. So our first question we have, on average, how long did it take to establish a partnership with public housing sites? Maria, will you be able to assist us with this question?
Yes, that's a great question. Actually, now that he or she mentioned it, I should have added that in the slides next time. So it depends. If it's, I think the finding the right person, it's key. So if you find that your main contact was not really engaged or has availability for what you want to do, you should look for another person. But in the average, I'll say that if we offer the classes, we start that way, and I don't know, it will take us, 2 or 3 months for them to get the service and they like it, and then we can move into a more formal relationship, like having an MOU and bringing the mobile unit and collaborating with health fairs. So if it's through our health education program, I will assume like 2 or 3 months. And if it's a relationship that you're cultivating just on your own, I think it all depends. If you get the right person, it could be really quick. I've started relationships as soon as, like within a week. And there's ones that you have to invest a lot more just to get in with the health education classes. Will take us a couple of months. So it all depends on finding the right person. So if you don't find the right person, get another person that may help. I'm hopeful that that answered your question.
Thank you so much, Maria. I think that was very helpful. And if you need is that a little more detailed, please enter anything else in the question box. Emily, I think we now have a question for you. How can our health center apply for public housing funding?
That's a great question. So there's a couple of times, I think once a year or so, that HRSA comes out with new access points. And basically, when they come out with a new access point or new service area funding opportunity, that's when your health center can kind of expand your scope of services. So if you don't receive public housing funding, but you feel like your health center is accessible to public housing and serves public housing residents, you can let HRSA know that you would like to expand your scope of services or change your scope of services. And that you just sort of do by justifying based on, you know, rationale around where your health center is in relation to housing, and also your willingness to partner with residents and include residents in your planning for operating a public housing site. So just be on the lookout, and you can also ask your project officer at HRSA about this, but be on the lookout for service area expansion and like funding opportunities from HRSA.
All right, great. Thank you so much. Let's see if we have any more questions. Emily, do you have any questions on your end coming in?
Not that I see on my end, no, Tiara.
Okay, well, we would like to conclude this webinar. Again, if you have any more questions, please feel free to send an email. We will also provide slides on the website. And we would now like to just ask you a few questions. First question is, did this presentation meet your needs? If you can please just take a few seconds to answer yes or no. All right, thank you, everyone. Our next question is, how likely are you to apply the information from this presentation in your organization? All right, thank you. And how well did the presentation meet the stated objectives? Thank you. And our final question is, would you recommend this webinar to others? Great. Thank you so much, everyone. Again, please, if you have any questions, please feel free to email us. And we would like to thank you for this webinar, and you have a wonderful day.